Hello, Jackie. Thank you for joining me.
Sure.
It is quite quite an accomplishment to live with CRPS, but you've also been diagnosed with cancer on top of which, and that's got to be hard too. That's a double. But yeah, to start with your CRPS, when did that start for you?
Started about, I would say, 12, 13 years ago.
Okay, okay. What region of the body did you get that with?
It was my neck and my shoulders, upper arms, shoulders. I'd taken a hard fall and hyperextended my right arm and hit my head and bent my neck back. And
Ouch.
um, and I'd had before that had surgery on my neck just a year prior to that.
Right.
And I'm not sure if if it was the combination of both, or because I know that
Yeah.
surgery can also
Yes, it
CRPS,
can.
as
Yep.
can like any trauma, physical trauma, or even
Yeah.
mental. And so it was that night that the pain got really bad, and then I had gotten where they do a nerve conduction test because we didn't know what had happened with all the pain I was having. And what
Hmm.
it did was kind of spread it and send like electrical impulses and like misfires throughout my whole body. And so I was in bad shape for about a month.
Yep. Yep.
And then I changed my diet, stopped eating, processed food, and slowly over time it just kind of was mostly up in the area where I had injured it instead of like everywhere else. and
Yeah.
um so then I just seeked out treatments of different kinds over the years, mostly failing. But
Yeah.
eventually, years, I would say probably 4 or 5 years ago, I found Botox injections that actually helped.
Okay.
And then my insurance stopped paying for it, and I had to seek out other treatments that failed. Injections, infusions, everything short of like a morphine pump that they wanted to put in, which I
Yep.
didn't do. And I almost did, and then became disabled, and Medicare and Medicaid, like state funded disability insurance, paid
Yep.
for the Botox again. So I was able to get that
Yeah.
again just before, like 5 months ago, being diagnosed with melanoma.
Okay. So what other symptoms are you getting with the CRPS? Do you get
Um,
like the discoloration and swelling and
I never
um,
did until I recently had the melanoma removed 5 months ago. And
right?
then I had another surgery done on the leg, and then I had my lymph nodes removed out of that leg, and it triggered um, the swelling, the redness, the burning, feeling like dipped in oil,
Yep. Yep.
mostly in that leg where I had the surgeries. But it also spread to my other leg.
Hmm.
Not
Hmm.
as bad, but still enough to make it bothersome.
Yeah. Yeah.
So,
I mean, one leg's bad enough. At least you can sort of hop, but when you get both
sure.
legs, that's that makes it
Yeah,
very
right.
difficult. Yes.
Absolutely. Yeah.
Yeah.
And the other symptoms, of course, sometimes when it's really bad, being sensitive to noise, the
Hmm.
cold, the rain, the barometric pressure affects me
Yeah.
tremendous.
Yep.
I
Yeah,
mean,
it's
it's
the
different.
pressure, isn't it? You can feel it before the rain comes on, and you can
Absolutely.
feel the
Like, yeah,
change, and
feel like a month of sorts. Yeah, for sure.
yeah.
Um, and I don't know about any other people if they've had like loss of appetite.
Hmm.
Let's see. Well, the medication, I'm not sure if it's the CRPS or the medication that causes brain
Yeah.
fog.
Yep.
You know, so
Yeah.
that's hard to say. But I'm gonna try not taking some of the medication for inflammation, as I changed my eating habits dramatically when I did get cancer. And I
Yeah.
noticed that a lot of the inflammation that I had disappeared as soon as I cut
Okay.
out like all these red meats and processed foods and
Yeah.
sugar and all those things. For the first time, like in a long, long time, I had no inflammation, which was pretty
Yeah.
amazing.
They say diet is a part of it,
Yeah,
and that's the cycle. Is as you say, you lose your
yeah. I was
appetite.
told years ago, and I was like, yeah,
Yeah.
sure, yeah, right, and
Yeah.
I'm like a total advocate for it.
Yeah. Well, the latest, research on how it affects your internal organs is because of the lack of blood flow in the affected areas with your CRPS, you get extra blood flow in your internal organs, which causes them to swell, causes sharp pains, slows down your digestion,
Oh,
and that's actually quite common for CRPS. They thought at
yeah,
first it was CRPS moving to the organs, but
mm.
it's not. It's the extra blood flow that they can't handle.
It's very
Yeah.
interesting that I thought maybe it was going into my organs because I will have a lot of
Mm.
rib cage pain.
Yep.
Um, so
Yeah.
mm,
And now the next step is to work out how we, stop that happening. At least they've found out, what it is, but I guess it would mean getting more blood flow into the affected area, you know, would be the only way to sort of prevent it, I'd assume. That's step one, if that's possible.
yeah, mm, good
Mm.
to know that.
So the Botox you were saying, most people think of Botox and they think, the injections to make your face tighter and
Yeah.
everything like that. Are we talking the same stuff, or are we talking something different,
Yes,
or?
exactly the stuff. Exactly the same stuff. Basically, what it does is it paralyzes the muscle,
Mm-hmm.
and usually it's the muscles that um, will spasm and then, in turn cause the nerve pain. For me, anyhow.
Yeah.
And so I could only get them every 3 months per insurance for any
Mm-hmm.
insurance. That's all they allow. Usually lasts just under 3 months,
Okay.
and it takes about 2 to 3 times of getting the injections for it to get the full effect of it.
Yeah.
And it's for me, it's been tremendous. It's like the difference in like laying in bed and going out and doing things. So
Yeah.
it
Okay.
was amazing.
And
Yeah.
this is
And
just
the trick,
outpatient, sort of
yep, just
simple
outpatient. Um,
in and out
my my husband
process.
would like go along and press on my muscles to see where I was sensitive, and he
Okay.
would take a Sharpie and just put a little dot there so that when I went in, he could go really quick and hit all the spots because there was
Okay.
many.
Yeah.
So,
Yeah.
but it would take forever for me to show him and, for him to hit
Yeah.
all the places, so
That's a good
many
idea.
muscles that were being affected, like the front of my neck, the side, the back, my
Yeah.
shoulders, shoulder blades. So by doing that, he would be able to go and hit like every spot very quickly and
Yeah.
done in like a few minutes. And
Yeah.
the little bit of it felt like a bee sting, and the pain of that compared to the pain of CRPS was
Yeah.
minimal.
Yeah.
So it's
Compared to
well
the
worth it.
yeah. 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 For sure. Okay. Yeah. So you got diagnosed with cancer as well just recently, and
Yeah.
how's that working out for you? Um.
Um, so far, I mean, it's been taken out, and it showed up in my lymph nodes, 3 out of 9 that were removed. But that's
Yeah.
it so far, and so keep my fingers crossed and trying
Yeah.
to take really good care of myself because with CRPS,
Yeah.
I'm not a candidate for any medication or for radiation
Right.
or chemotherapy because what it could potentially do to my system having the
Yeah.
CRPS,
Yeah.
which
Yeah.
I never knew. So
I mean,
Anyone
there's
that,
sort of the CRPS destroys your immune system as it is, you know, and
and I'm sure that
anything
all these
else you
other
do is gonna,
just
yeah, just add to that.
get far
Sure.
worse. Yeah.
Yeah.
But I mean, the success rate of those things aren't that great, and what they do
Mm.
do to your body is pretty brutal sometimes. So for
Mm.
me, it wasn't that devastating. I mean, because I know my family is like, yeah, do whatever, do the chemotherapy, do whatever it takes. And for me, I was like, well, I kind of don't know if I really want to go that route. I think I'll go natural and go and do that route rather anyway. So for me, it wasn't as devastating as it may sound.
Yeah. Yeah. Yeah.
But maybe that was a good thing that I'm not a candidate for that, because from what I've heard and from what I've seen, it can be very devastating. And
Yeah.
some people actually die from the chemotherapy. So
Yeah.
you know,
Yeah.
it's not,
That's
it's
right.
not like a magical thing. That's
No, no, it takes a certain kind of person to sit through that as well. That
sure.
you've got to be quite comfortable with doctors and hospitals and stuff for starters, because you've got to prepare to spend a long time
Yeah, absolutely.
sitting there doing, yeah, very
And
little.
there's all kinds of different things out there that people are doing, and diets and seeds and oils and all kinds of stuff. So
Mm,
that will be what I will be doing,
mm-hmm, mm-hmm, for sure.
along with a healthy diet, of course.
Yeah, yeah. You haven't tried acupuncture or anything like that then?
No, my daughter actually suggested that just the other day. She has a friend that does it, and she's says she's very good, and I should give it a try. So that might be something that I will try for sure.
Mm.
Right
Well, I was
now, I
thinking
keep
that if the
having
Botox
flare.
is working, it might be
Well,
a similar thing. I've never tried the acupuncture myself, but I'm just
it
thinking
could,
it,
it could be
it would be a
interesting
similar
though.
sort
The
of
two together might
process
be.
though, especially having so
Yeah,
many spots. You know, I mean, the neck is pretty, is a quite a sort of sensitive in the back, sensitive area. It's your whole, it controls your whole body, how you sit, lay down, whatever it is. Your neck or back is sore, then doesn't matter what position you're in, you're gonna be, you
right.
know, in a lot of discomfort. Yeah, yeah. I mean, I get the CRPS to sort of move to my neck a bit. I get just that constant sort of pains, and then every now and again it just gets so vicious that I'll be vomiting and I'll be
Mm.
yeah all over the place. Sort of it, you know, but it hasn't been going away lately. That's been my
Have you tried
last 3 or 4
acupressure?
weeks. You know. No, I mean, I really haven't tried much at all. I've
My
had
doctor
troubles
has me do
with work
that
cover and
if I
stuff.
have
So.
like a muscle that's really bad, and she'll have me press on it and put a lot of pressure on it, but also turn into it instead of turning away from it, because you think to
Mhm.
stretch it sometimes will
Mhm.
help, but it actually makes it worse. So turning
Yeah.
into
Yeah.
it, some pressure on the muscles sometimes will break it up.
Yeah. One's right in the base of the neck in the spine, and
Tough
I've
spot.
rubbed it so hard I've bruised the area. So when the sort of
Yeah.
the CRPS has gone away, I go to rub the area and it's bruised. My wife's looking at it and I've got
Sure.
fingerprint
Yeah. Oh,
bruise marks in the back of my neck, you know. So um, yeah, yeah, no, we do them things. I used to scratch my
yeah.
cheeks until they bled. You know, little things like that, just from clenching
Remember,
jaws, you know.
I used to put like, the menthol creams on so much that it literally like burned my skin.
Yes.
Because it was
Yeah.
just like anything to get rid of the pain.
Yeah, even if it's a placebo, even if you know it's not working, but you think it works, and you know,
Yeah,
and if the pain goes away at the same time, coincidentally, then that's enough for you to accept it, you know, whether it was
it
real
has
or not.
to be. Yeah.
Yeah, absolutely.
Yeah.
So you got cold weather where you are at the moment? Is that
Um,
something you're
it's
struggling
not
with?
that it's so cold. We're at the beginning, well, we're between like spring and summer starting, but it's been
Yeah,
damp and rainy a lot. So it's been hard for me to recover from my last surgery, and having
yeah,
CRPS in that area also. So it's been
yeah,
affecting it good, but hopefully it's going to warm up here soon, and I'll feel a bit better.
Yeah, for sure.
Yeah.
Sure. Hmm. Oh, is there anything you'd like to leave for the viewers out there?
No, just to, I guess maybe just always have hope and never give up.
So we can do is
Yeah.
hoping it.
Yeah.
Yeah.
You never, maybe someday, they'll come up with some magical thing.
Well,
Have
it's
hope.
they are they've come up with one recently for heart cancer or something. It's not a magic pill or something at the moment, but it can reduce the amount of times people are going to hospital and stuff because it, helps to do something to the heart, which is, for people that are susceptible and stuff like that. And they reckon it's
Right.
a bit of a breakthrough. So that they
Yeah.
are coming up with these little minor miracle pills, and it'd just be good to, I think, have something that CRPS patients can sort of officially take because
Right.
there is no official treatment for it. No, I mean,
No.
everything is just trial and error for every individual because we all sort
Yeah.
of react differently, unfortunately.
Right.
So
And I
it'd be
remember when
great
I
if the
first
doctors
got,
could just go, oh look, you've got CRPS. Here's the treatment. Let's give this a go. It may or may not work, but at least here it is. But they don't. They go,
right.
all right, you've got CRPS. I don't know what to do. you know, they got
Exactly.
nothing.
Or many times in the beginning, I remember hearing, "What is that?" And so.
Yes,
And
yeah,
in the beginning, I remember doctors saying it was all in our head, and that
yeah.
it's test and
And in the beginning, as you say, we don't know much about it ourselves.
right,
I got it 12 years ago nearly, and social media wasn't around. Facebook was, I think, in its infancy, used for
right,
college students and stuff at the time. Um, it, the options just weren't even there to sort of get onto the social media and talk amongst each other to find out what's going on. So
right,
for years, I thought most of my symptoms were my own, my body breaking down individually. No one else is
right.
going through what I'm going through, you know? Like,
Oh,
yeah,
and for it to be something invisible that doesn't show up on an X-ray or a test, it was just so
no,
hard for me to wrap my head around it.
mm-hmm,
Like how can it
mm-hmm.
not, how can it be this such a painful thing that it doesn't show up as anything.
Yeah, yep,
Very hard for me to wrap my head around it in the beginning
mm,
because I'd never heard of it. So
I mean, I was quite insulted when they told me it was to do with my brain. It's part of your brain in your head, and I'm pretty strong-willed. You know what I mean? Like, what are you talking about? I'm not allowing this to happen. Like they're saying, something. I mean, I'm not. And then I wasn't. They weren't implying that I'm making it up. They're implying that it's the rewiring of the brain. How they, I mean, they don't know really, so they can only give you
right,
their best explanation. And I was getting
right.
insulted. Like, come
No,
on.
exactly.
Yeah.
That's how I took it as I was imagining it, like it was in my head.
Mm,
You know what I mean?
mm.
Like something that I was making up in my
Yeah,
head, which just
yeah,
you gotta be kidding me, right?
yeah,
But that could be how ketamine works, maybe. I'm not sure about it, but I know that here it's a treatment when it's severe that's done on sometimes on like just a few hours to like
mm,
even you know weeks and weeks of treatment.
mm.
And I believe that it had something to do with tricking the brain somehow into forgetting the pain after the infusion happened.
Yeah, yeah.
um, I don't know much about it, but that's kind of what I gathered from it. And
So
I
you
was
haven't
also
had ketamine infusion?
oh
No.
that if the Botox didn't work, that was my next route, was to
Okay.
do that. I could travel a few hours to a big city and
Yeah,
have it
yeah.
done. But I was also told just recently that if a ketamine infusion is given before surgery and after surgery, it will prevent a flare up, which I
Yes.
found
Yeah.
really interesting, which is good to know because if the cancer did show up somewhere in my body where it's operable, that they would do that, of
Yeah.
course. But
Okay,
it
that's
would
good
be
to
nice
know.
to know that if I could prevent something like that from happening, It would make
Yeah,
the
yeah.
surgery a bit more not as scary anyway.
Yeah, absolutely. Especially if it's in a different part of the body with no CRPS. You
Yeah,
don't need it
which would
moving.
yeah,
You don't need it
that would
flaring
be
up in
good.
the position it's in, but
Oh,
you don't need it in another part of the body.
absolutely not,
You know.
especially not in Turkey. I mean that would be just the worst.
Yes, yeah, absolutely. Mm. Well, thank you very much for chatting with me. This is
Oh,
it's been
you're
quite
welcome.
interesting. Yeah.
Yeah, my pleasure.
All right.